You're watching Reality Check. With every day, India's anti-coronavirus lockdowns are becoming more severe. Now, domestic flights are going to shut down from Wednesday. And state after state, locking down. We'll put those images on the screen for you. Buses, trains, shops and businesses are locking down. Those are images that you can see from across the country. The lockdowns are in response to the steady rise of the virus that you can see on your screen. Let's now put on the screen what is the condition, what is the state of affairs of the virus. Let's look at those figures now. This is where we now stand with India. The coronaviruses by date rising steadily every day. 81 cases reported yesterday, 37 so far today, but that figure could go up. So that is the climb of the coronavirus in India. Look at how it has taken off, particularly in the last week or 10 days. It has now hit 433 cases in India, and we have had 8 deaths so far. 1 death reported in West Bengal. Now, it's because of the spread that these lockdowns are crucial. But as the World Health Organization says, they are not enough. Countries need to do much more to try to address the question of how to contain this drug. Countries need to test more and need to be better prepared for a potential worsening of the outbreak. India, however, says they will continue with very focused testing. Only those who have travelled or come in contact with someone who has travelled and are showing symptoms. So if we've tested about 17,500 people in 53 days, that's 330 a day, much below our capacity of 10,000 a day. Let's just look at those numbers. 17,493 tested in 53 days. If the graphic can change, it will tell you 330 a day, well below the capacity of 10,000 a day. Now, India's medical officials continue to insist that the disease has not spread enough to the extent that we need to broaden testing. They say they have done sample tests of those with severe lung infections and found all to be negative. But those are only about 800 samples, too small for a country like India. The government also says they're monitoring 50,000 people in hotspots as part of the National Central Disease Centre's ongoing efforts to track diseases. That too, they say, has not yielded much to worry about. Now, so far, India has expanded the number of government labs to 114. Private players too can now test. But all our labs, are they up to scratch? My colleague Arvind Gunasekar spoke to 50 government labs across 12 states. And this is the reality check. We contacted, as I said, 50 labs in 12 states. 43 labs were fully operational. They could both test and declare results. But 7 labs are not fully operational yet. Those laboratories have to send samples to the NIV, which is the National Institute of Virology in Pune, or to a nearby lab to have its sample tested. These 7 labs are still to pass due diligence by the NIV in Pune. So, fully operational labs we found in states like Delhi, Haryana, Tamil Nadu, Telangana. Partly operational labs in Rajasthan, Bihar, Maharashtra, Gujarat and Assam. Karnataka and UP, we couldn't get the numbers of all the testing centers to be able to test whether they were functioning at 100%, because some labs have been given information, or the information put out about some labs for the contact person is wrong. Like in the MP Shah Medical College in Jamnagar, Gujarat, the contact person is not working in the hospital anymore. In the Gulbarga Institute of Medical Sciences in Karnataka, wrong number for the contact person. Same in the Madras Medical College in Tamil Nadu, wrong number for the contact person. In Coimbatore Medical College, Tamil Nadu as well, wrong number for the contact person. So that's where we stand as far as that is concerned. So this now brings us to the question of whether we actually are prepared or not for the coronavirus. One of the big questions, of course, is the fact that we have a shortfall of protective gear. And if you can put that graphic up on the screen, shortfall of protective gear is something which has become a big issue when it comes to India. We're talking about protective gear that is required to protect our medical professionals. 60 lakh N95 masks needed, 1 crore 3-ply masks needed, 7.25 lakh body overalls needed. But safety gear makers are complaining of a delay in placing orders. They say that the Textile Ministry and the Health Ministry is passing the buck. The government has denied the bottleneck and says 6 companies have been shortlisted. Let's move to the question of ventilators, something else that's needed. India reportedly has 40,000 ventilators. These are not official figures. This is an estimate, which many say is too small for our population of 1.3 billion people. The government has placed an order for 1,200 ventilators, but experts project a severe shortfall. One ventilator maker actually has tweeted an SOS. This is Divakar Vaish, who runs a company that makes ventilators. He says, "We'll soon be over with ventilators. Raw material and production will entirely halt. International freight service is not fully operational. We are stuck." He's asking the government to help them. We'll have him on the show in just a second. Also, when it comes to ICU beds, do we have enough? India has only 2 ICU beds per 1 lakh persons. And put that graphic up on the screen for you. India ranks 17th in Asia when it comes to ICU beds, below Thailand, Iran and Nepal. That's how low we are when it comes to ICU beds. We can actually put up the chart that compares India and where it ranks in comparison to the other countries. So look at that. India all the way below at just 2.3 beds per 100,000 population, and this is just as far as Asia is concerned, not other countries. Okay, joining us tonight on the debate, we have with us K. Sujata Rao, former Secretary of Health in the Government of India. Lalita Kumaramangalam is with us, Director India Foundation, member of the BJP. Dr. Arvind Kumar, Chairman Center for Chest Surgery and Chest Oncosurgery, Director Robotic and Thoracic Surgeon. And we also hope to be joined by Professor Divakar Vaish, who is going to be joining us fairly shortly. Let me just start with K. Sujata Rao. Now, when you look at our preparedness, so we're just putting out some numbers there. When it comes to critical care equipment, when it comes to safety gear for professionals, and of course the question of testing I'll get into in a minute, but are we ready for a situation, God forbid, that never happens, where the virus gets much worse?
Well, this is a very tautological question, because it all depends on, are we ready for what numbers? If it is just the numbers that we have today, yes, that's adequate. But if you're talking about large numbers like 60,000 people needing ICU treatment or something, of course we are not ready. So it all depends, it's relative to need and demand, what is the supply. Having said that, yes, it is true that in India we do have serious infrastructure gaps, and these are also inequitably spread. Northern states are definitely far worse than the southern states.
Right.
So if this infection were to spread much more rapidly in the northern states, we really have a problem, even if the numbers are not very large. They won't be able to absorb even the slightly upped up and scaled up numbers, which a southern state may be able to absorb. So there's inequity in the infrastructure, and there is overall shortage in the sense of, again, as I said, what numbers you're looking at. So whether it is, it's not only a question of ventilators. Ventilator you will buy, but there's a whole range of the infrastructure, support infrastructure, to make the ventilator useful and usable. So trained people, the oxygen, all these kind of infrastructure can be ramped up in overnight or in a day or two. So that's going to be a serious bottleneck, and that's the reason why there are the strategic options that are being looked at and should be looked at is, one, continue to focus on prevention. We'll come to that. In terms of infrastructure, try to screen the patients. Those with mild forms of the infection can be treated at a lower level. Don't let them crowd into your hospitals. And those who are very sick need to be taken in. Now, it's not 1.3 billion people who would need this ventilator support. It's 5% of those who are very sick and particularly elderly.
Right.
In Italy, the age of the elderly is far more than ours. So we have a little window there that maybe we may not have that many serious cases. So I think they are all related issues and need to be looked at in a very critically angular and decentralized way, not just make aggregates and get alarmed.
Okay. But Dr. Arvind Kumar, what would you say? Because, of course, at the moment, the numbers, touch wood, are still conservative, but we are seeing a steady rise. Now, the government continues to maintain that this is still not what is called community transmission, where it's spread outside of people who've directly come in contact with someone who's had the disease or have traveled abroad and managed to infect themselves. What are the numbers telling you? Is that a credible argument for the government to still make?
Srinivasan, as a doctor who's been following all this very, very carefully and has also studied what happened in China and what happened in Italy and why it happened, whatever happened there, and is desperate to prevent or prevent that from happening in our country.
Right.
There are a few irrefutable facts. Number one, that right from the time the first case was reported, in the last 3 or 4 days, the number of cases, reported cases, are on the rise. That's number one, irrefutable fact. Number two, some of these people might have come in contact with other people and possibly might have transmitted. Well, whether we have been able to find that or not remains to be seen, but theoretical possibility is there. Now, I would use these two irrefutable facts to say that this is exactly what was happening in Italy in the initial phase when their cases were rising, but they were sleeping. They did not take the measures which needed to be taken to prevent the large-scale transmission of the disease, and see what they are facing today. And therefore, I would reiterate that today and next few days is our golden window of opportunity, where by preventing further transmission, we can still contain the disease at a stage where the Italy-like situation will not arise.
Now,
just one more minute. Minute.
Let me ask you. No, I'm coming to you only.
Okay.
I'm saying you say prevent. So we're now seeing lockdown across the country. That's obviously one way of preventing. But are we doing enough? Coming back to that debate, are we testing enough? And are we also tracing, what is called contact tracing people who may have been exposed? Are we doing all that enough as well?
So I think as far as testing is concerned, now up till now there were government labs available.
Yes.
Now today a good number of private labs which have chains across the country have been authorized to do testing.
Yes.
Of course, I as a doctor would strongly argue against indiscriminate testing. If somebody was to suggest that, okay, let's have infrastructure to test the whole country, that's not going to help us. But use of all possible means to prevent the spread of the disease is our best option today, and let's focus entirely on that.
Okay. Rajiv Nath is with us. Rajiv Nath is with us on the phone line. He is Forum Coordinator for AIMED, Association of the Indian Medical Device Industry. Rajiv Nath, thank you for joining us. As I was just pointing out earlier, that there seems to be some question marks over whether or not we have the safety equipment, what is called the personal protective equipment, PPE, for our medical professionals. Masks, hazmat suits, and so on. Is that being addressed, or are there still concerns about how the government is going around trying to procure them?
Well, yes, definitely there are concerns, I would say. we have been told by the government that they have an inventory of about 16,000 suits of the DuPont Tyvek category to be used with the infected patients and the critical patients, which they are, I think, keeping as a buffer for when the problem is really going to get more severe. But they have shortlisted 3 to 7 manufacturers with the claimed material, which they feel is the appropriate material to make the suits.
Okay.
But the quantity that they can make and they can gear up is a few thousand pieces a day, whereas what is required on today's date would be in preparation should be nearly about a few lakh pieces a day. So that's definitely a challenge. We've shared with them.
Just a second, sir. Just for our viewers to understand, what you're saying is that they've shortlisted some manufacturers now who can produce a few hundred pieces a day. But what you need are in the range of thousands of pieces a day. Is that what you're saying?
Yeah, thousands of pieces a day, whereas we need, I would say on today's date, close to, by their own submission of numbers, 7.5 lakh pieces we'll talk about, so nearly a lakh pieces a day. So we've shared with them a list of manufacturers who make coveralls and gowns in the medical field,
right,
who can possibly make this kind of product, and see how we can collaborate with the government, and that capacity can be utilized to make this augmentation. So it's a collaborative.
When you talk of these pieces, you're talking of what? You're talking of masks? I mean, there are different types of masks. There are the N95, the 3-ply mask, the hazmat, the body overall suits. This is what you're talking about?
There is a PPE kit, what we call a patient protective equipment kit, in which you have a body suit, like a coverall kind of a thing. You've got the eyewear, the goggles, and the face shield or the face shield to protect the face. You've got hand gloves, and you've got the mask, which is can be the 995 mask, or it can be even a 3-layer mask if that is not available. So, and then you need to have a bag to dispose of the thing, and then you also need to have instruction sheet, because how a doctor is going to wear it and how a doctor takes it off is very, very critical, and that training is very important.
Okay, so just stay with us. I'll come back to you. We have Professor Divakar Vaish also joining us. He's CEO of Agva Healthcare. I was just reading out his tweet earlier, where he's someone who makes ventilators. Is that right? Divakar, you have a company that makes ventilators, and
that's right.
And you say that you were all set to produce 20,000 ventilators in 1 month. 20,000.
That's very correct.
That's a huge number. But
that's right. Yes.
You put out an SOS saying we can't do it. Explain why not.
So there are multiple challenges you need to understand. That at this point of time, we are completely geared up to. We have the technology. We have all the things ready in stock, but this stock is there with the OEMs, and we need to get these stocks down to our manufacturing facility here in Noida.
Sorry, what are OEMs? What is an OEM?
OEMs are basic. So OEMs are basically our manufacturers. So for example, we do not manufacture our own chips. We don't manufacture our own, we don't need to manufacture our own pressure sensors.
Right.
What we do is we take it from the industry, pull it together, put our program in, and we make a ventilator. That's how the industry works. So now, if I want to get a pressure sensor, if I want to get a microcontroller from let's say Intel or anyone else in the market, then I have to get it from these people, from their manufacturing plant.
Okay.
Now, since there has been a huge problem in the local and the international shipment department, because as you must be aware, because of the lockdown, the overall logistics have been completely disrupted, and there are multiple parts which are there in Bangalore, there are multiple parts which are there in Chennai, there are multiple parts which are there in Mumbai, but they are not getting mobilized. They are not coming down to us. These sensors, these vital components to make the ventilators are completely stuck where they are.
Because of the lockdown. Because of the lockdown, you're saying that the parts you need to make your ventilators are getting stuck in different, I mean, either internationally they're not coming in, or even within India they're getting stuck.
That's absolutely correct.
Okay. Now, just to understand, Divakar, because we were talking before the show, you were telling me something very interesting. You were saying that on an average, like in a normal time, you would make how many ventilators a month?
In an average, because the demand of the ventilator is not as much as we have right now.
Yeah.
We are talking somewhere around, let's say, 100, 150 units a month. So
100,
we only
150 units, and you are going to ramp
That's
up
right.
to 20,000 a month.
20,000, and just to prove that this is possible is because we have already ordered parts for 5,000 pieces. We have already put the money in to order 5,000 of
Okay.
these things, and another 5,000 we'll be ordering by next
That's
week.
quite remarkable. And also you were saying that what was interesting about your company is that that a bulk of the Indian hospitals, private, government imports their ventilators. Most of them are getting it from abroad. And the average cost is how much compared to how much you are making it at?
So average cost is close to 8 to 12 lakh rupees. It also goes up to 20, 25 lakh rupees for the higher end versions. But what we are doing is we are reducing the cost by 1/10 because it is an Indian technology, indigenous technology made completely in India. So we have been able to reduce the cost around 1.5 lakh rupees.
1.5 lakhs. So a ventilator that costs 8 to 12 lakhs, you will be able to produce for about 1.5 lakh rupees.
We won't be able to produce, but we are actually
you are producing. Okay,
Yes.
but you've run into this roadblock and you're appealing to the government. Lalita
Yes.
Kumaramangalam, I know that the government has its hands full because this is a massive crisis and they're trying to, it's like an orchestra to conduct many moving parts. But is there a worry that sometimes it feels like the left hand is not clear what the right hand is doing? You have to put in measures of lockdown, you've got to prevent movement of people and all of that, but then you also have problems like this. This is holding up critical needs that we have.
Everybody, regardless, whether it's the government, whether it is people who are at risk, whether
Sure.
it's people who don't know exactly where we are heading,
Yeah.
whether it's so-called experts, bureaucrats, etc. Now, it is a good thing that we have Indian entrepreneurship and entrepreneurs like the young gentleman who was speaking just now, just before me, who say that they are willing to pitch in and has actually come forward with the problems they are having. I'm sure the government is listening, and I suggest if he thinks they aren't, he should send an email straight to the PMO and it will be looked at. I can give you that assurance. Now,
Okay.
with regard
Divakar,
to
have you-
equipment that we may or may not need, I think I should
Divakar, can I
partly
just ask
echo
Divakar-
what Sujata ji
Okay,
said.
I'll come back to
that
Divakar. Go ahead. Go ahead, Lalita Kumaramangalam.
Sure.
Sorry, go ahead. Yes, you finish your
should
point.
we should pay heed to what Sujata ji said. She was the health secretary of the government of India when the HIV/AIDS epidemic was tearing through the world. And I mean, I have personally worked with her and I know how efficient and dedicated she was and still is. Now, we don't know what's going to hit us. At this moment, the most important thing is to flatten the curve. That is to make sure
Yeah.
that transmission is, I don't think we'll be able to avoid a certain number of transmissions in this country. You can't bring it below a certain point.
Right.
Given the way people live, given the amount of daily wage labor, etc., etc. There are many causes for that.
Sure.
But we need to be able to, if not halt, at least, decrease to the point that we can humanly do so, social transmission.
Right.
This is why I think the government is first paid heed to lockdown,
Right.
quarantine, whatever you want to call it, curfew. I know there are lots of negative terms being used, but this is why the government, and we have seen this happen over and over in many countries.
Sure.
With regard to testing, I don't think every country that has been able to deal with this epidemic has done it in exactly the same way.
Sure.
And I'm sorry to have it to say it like this, but the WHO didn't really come up to the mark in the early days of the epidemic when it was just in China. There was a lot of fudging of data, etc. But let's leave that aside. What's happened in the past, we can't change.
Yeah.
Let's not dwell on it unnecessarily. The thing is, we don't need to panic. The government, I think, is more than well aware of what is needed, and they are dealing with it. We've set up an economic task force for the revival.
think it's
post,
about-
this epidemic
Yeah.
revival. We're looking at every alternative that we can.
Sure.
And I know that everybody knows that if there is a full-blown epidemic, we
Yeah.
will not have enough personnel, we will not have enough enough
Okay, let's hope we never get there.
Probably even oxygen.
Yeah.
There are countries that have run out of oxygen. Exactly.
Okay,
So
let
the
me
best
just-
thing is,
yeah.
and this is an old saying that's said everywhere, that prevention is better than the cure.
Right.
So I'm not saying everything is hunky-dory. Nobody is saying it.
Sure.
But we are aware that we need to understand that it is an emergency,
Right.
and that we can't put the brakes on, and that we will go ahead and do the
Okay,
best.
let me ask Sujata. Right, let me ask Sujata Rao this: that the point that the WHO is making, that it's important to lock down, but that's still not enough to try to actually prevent the spread of the disease. And to that extent, do you think that enough is happening on that?
You see, no, the WHO has never sequenced any recommendation. They have been saying comprehensive prevention, and comprehensive prevention has 4 pillars, and that needs to be understood. You just simply cannot make a choice and say, I'm locking down, and sit pretty on the other aspects. And what are the other aspects? Testing, information dissemination, and doing your social quarantining and isolation of those who have been found to be positive.
Okay.
All these have to go hand in hand, and therefore lockdown is a very, very important critical first step taken.
Of course.
But that is inadequate if you don't ramp it up and accompany the testing part, because it's only through test, Vasu, that we know where is the infection and where is it moving. Unless and until you have a grip on that, unless you have a grip on where the infection is, you're not going to get it just on talking about aggregate general terms, that we are infected. One person is infected in district, you lock it down. How long will you lock it down? 1 week, 10 days, 2 months?
Right.
But maybe that guy has gone and infected the people he was staying with inside. So testing is extremely important part of it. It's not that it's not a choice either or. Everything has to go hand in hand.
Everything has to go hand in hand. We'll have to leave it there. Thanks very much indeed, all of you, for joining us.